This fourth video in the Home Health Billing series reviews what you need to know prior to billing the period of care claim. In our first three videos, we covered the information needed to verify eligibility for a home health patient and submitting the NOA. Since the NOA opens the admission period for the home health patient, we are going to continue our series with some information you should know prior to billing a period of care claim. In our video on verifying eligibility and understanding the payment model used for home health PPS, we discussed all of the different categories for grouping under the patient-driven groupings model. This chart helps visualize how those different categories are reflected in the Health Insurance Prospective Payment System code, or the HIPS code, reported on your period of care claim. First, we're going to review a little background information that will help you understand what you need to know before you bill a period of care claim. The claim should be submitted at the end of the 30-day period, or when the patient is transferred, or when the patient is discharged. All services must have been provided to the beneficiary, and the physician needs to assign the plan of care in all orders. Also, the face-to-face encounter must have been completed, and the OASIS must be submitted and accepted in the state repository, or IKEs, prior to billing the 30-day period claim. Any warnings received on the OASIS, regardless of whether it was accepted in IKEs, should be investigated and corrected. And all services provided to the patient in the 30-day period, whether they're considered covered or non-covered, must be reflected in the line items reported on your claim. Once the claim is received, the home health PPS payment the claims processing system assigns under PDGM will be made on the period of care claim once it processes. All home health services are subject to home health consolidated billing. This means that all services provided to a beneficiary in a home health period must be provided either directly or under arrangements by one home health agency. Services that are subject to consolidated billing include nursing services, therapy services, routine and non-routine medical supplies, home health aid services, medical social services, negative pressure wound therapy using a disposable device, and certain covered osteoporosis drugs. All of these services are paid on a cost basis included in the home health PPS rate, and payment is made to the primary home health agency regardless of whether they were provided directly by the home health agency or under arrangements with the home health agency. Now, the only two services on this list that are currently not part of the home health PPS claim are the negative pressure wound therapy using a disposable device and certain covered osteoporosis drugs. Even though they are billed separately from the home health PPS claim, they are still considered part of home health consolidated billing. Now we're going to review some important information about the OASIS. The OASIS used in determining the claim's HIPS code for claim payment is based on the most recently completed assessment. Each claim is going to trigger a query to IKEs to find the associated OASIS assessment. Specifically, the system is going to look back from the claim's from date to find the most recent assessment and match that assessment with the date of the occurrence code 50 reported on the claim. Under PDGM, the start of care assessment, the follow-up recertification assessment, the resumption of care assessment, or other follow-up assessments will be used for payment. Now, when the assessment is found in IKEs, answers to certain OASIS items are returned and stored on the claim record, and the Medicare system will then combine those OASIS items with the claims data, send it to the grouper, and that will create an appropriate HIPS code. And it's this grouper-produced HIPS code that will then replace whatever the provider submitted as the HIPS code on the 002 through revenue line, and it's that code that is used to pay the claim. If the assessment is not found, the claim is going to be returned or RTP'd back to the home health agency for correction. There may be times when you have to correct the information on the OASIS after you've submitted your period of care claim to Medicare. Keep in mind, there's no need to adjust the claim every time a correction is made to the OASIS. Since there are only certain items from the OASIS that are used to determine the functional impairment level in the PDGM case mix grouping, the only time the claim would need to be adjusted would be if any of these items are corrected and the home health agency believes the changes to those items will have an impact on payment. One other piece that affects the PDGM case mix grouping is institutional versus community admissions. When a home health agency is aware their patient had an institutional or post-acute stay prior to admission, there are codes that can be entered on the claim to indicate that. Occurrence code 61 is used when the patient has been discharged from the hospital within 14 days of the home health admission. And occurrence code 62 is used when a patient has had a post-acute stay in a skilled nursing facility, an inpatient rehab facility, a long-term care hospital, or an inpatient psychiatric facility within 14 days of the home health admission. You can only report one of these occurrence codes on your claim. If there were 2 inpatient discharges prior to the home health admission date, you would just report the discharge closest to the from date of the claim. If the claim is submitted with both an occurrence code 61 and an occurrence code 62, that claim will be returned for correction. One last note about claim requirements for billing is that all home health claims have to include a site of service code. The revenue line with the appropriate site of service Q code should use the same revenue code and date of service as the first service reported on the claim. The revenue line with the site of service code also has to be reported with 1 unit and a small charge, for example, a penny. If the patient's location changes during the period of care, a new site of service code will have to be billed with the first visit in the new location. Thank you for watching this video on the information you need to know in order to get ready to bill a period of care claim. In our next video, we'll get into detailed billing information for the home health claim. So please finish this journey with us and watch our final video on billing the period of care claim.